Good morning. I'm Gail Cowan, the Adair County Judge Executive. We're here to give an update on our COVID-19 exposure and cases here in Adair County. We've had a lot of rumors going around yesterday, so I'm going to turn it right over to Shawn Crabtree with the Cumberland District Health Department.
All right, so the number of positive confirmed COVID-19 cases in Adair County right now is going to be either 32 or 33. I'm a little confused whether it's 32 or 33 because one of those folks that have tested positive may actually be a resident of another county, and it would count in that county. Right now I'm going with 32 as my number, and if that needs to be changed, we'll update it on our social media later. We have had, last week, we had some confirmed cases in our local nursing home, Summit Manor, here in Adair County. Out of to be expedient and comprehensive in the response, the facility found access to get testing of all of their patients or the residents and their staff, and those test results have started to come back in, and there were 23 residents who tested positive along with one staff member, and the staff member the residents may be in another county, so that's where I'm off on the 32 or 33. Let me begin by reading a statement from the Summit Manor, from Signature Healthcare, who owns Summit Manor. It goes like this. Last week, Summit Manor had its first resident test positive for COVID-19. Since that time, and as a proactive approach, Summit Manor was lucky enough to secure reliable COVID-19 testing for all of its residents and staff. A considerable number of those lab test results have now returned. Now, some of the labs had to be sent to one lab and some to another lab, so we don't have all the results in, but this is what we know today. 23 residents tested positive for COVID-19 along with one staff member who the staff member was sent immediately home and will not return until appropriate medical clearance. In light of the same, and in accordance with the most recent pointed instructions from CMS, which is the Centers for Medicaid and Medicare Services, and other government and national healthcare organization agencies, we will be transitioning one of our faculty halls to a COVID-19 only unit. If you're familiar with the layout of this building, it's a two-story building. There's a kind of a central spot and two wings that go out on each side of the building. They will be designated one of those wings on one of those floors as a COVID-19 only unit. Let me continue here with their statement. The various instructions that they have received and are implementing are as follows. The instructions were: we strongly urge long-term care facilities to begin now creating separate wings, units, or floors by moving current residents to handle admissions from the hospital and keep current residents separate if possible. Long-term care facilities should also develop plans for consolidating residents between facilities to create new facilities to accept hospital discharges who may be COVID positive or negative or harboring the virus because testing is not available. Another point, as healthcare provider, Summit Manor strongly believes its calling is to care for those patients who need us most right now, and Summit Manor intends to respond to this calling as our community needs us. Another point, accordingly, Summit Manor will be opening a temporary COVID-19 only dedicated unit that will care for only persons with COVID-19. Again, that's the wing in the building that I was referring to earlier. This unit will be isolated with barrier systems in place, protecting it from access to the rest of the facility. Will have its own supplies, food. Will have dedicated trained staff who will stay on the unit at all times, separate from the rest of the facility and other staff. And importantly, this staff will only work on this unit, not anywhere else in the facility. Summit Manor is making moves as we speak to solidify this unit. I did call in and speak with their administration this morning, and they have been able to move all of the residents around in the building. They have the positive cases in a different part of the building than the negative cases, and then the cases that the lab tests were undeterminate. So they've all been separated. And the unit they're talking about, they worked on it until late in the night. They're working on it this morning. Really what they're doing is just setting up temporary barriers in the hallway to make sure that it's sealed off from the rest of the unit. That should be in place hopefully by lunch today, or at least by the end of the day. So Summit Manor is making moves as we speak to solidify this unit. This means that all residents who tested positive for COVID-19 will be cared for in-house on that special unit. And if at any time, should the facility or resident's physician feel that a higher level of care is needed, the resident will be transferred out immediately to a higher level of care. So far, last night, one resident did develop some additional respiratory complications and were transferred to another medical facility, a hospital, TJ Sampson, I think. Summit Manor also has an infection control physician and specialist nurse on call from its home office who are assisting in monitoring this specialized unit. Summit Manor has notified all staff and families about this groundbreaking transition and cannot thank them enough for the positivity, compliments, and prayers in response. And it also cannot say enough about the caring, committed, and courageous staff it has. They are nothing short of healthcare heroes. Summit Manor also greatly appreciates all the support of the county and city officials working in partnership with them as we all work hard together to keep everyone safe and healthy in this unprecedented and ever-changing COVID-19 environment that our nation faces right now. Please keep your community support coming. It is noticed and appreciated. A signature Summit Manor is caring, committed, courageous, and signature strong. And that was released from Jason Shelton, State Operations President, for signature. I have some additional comments that I would like to make this morning. I noticed last night that we were taking a beating on social media for not releasing this information last night and holding to release the information this morning. There are reasons why we make these decisions and do the things we do, and I would like to go over some of those so everyone can better understand what we're doing and why we're doing it. So why do we release the information that we release? Well, the number one piece of information that you're going to always hear me say and repeat over and over and over again is that the best thing that the public can do right now is to follow the governor's recommendations about social distancing. If you have to be out quick, come right back. Don't go places where there's crowds. If you see crowds, avoid that. If you have to go in someplace where there's other people, keep the 6-foot distance and then get out. If you feel sick, stay home, cover your cough, all of those kinds of things. Why is that the main message that I'm giving to you all? Because that's the best information that can go out to protect the public right now. There are certain types of information we can't release. We can't release individual patient information that is protected by the Health Insurance Portability Accountability Act. It's private, protected information, patient information. It is in place to ensure that everyone's individual medical situation is private, and they have the right to share that information with who they see fit, but we don't have the right to release that individual case information. Unless it is essential for the public's protection, releasing the names of businesses is something that we generally don't do. There are reasons why that we don't do that. Now, what do I mean by a business? I mean, if there's a person that tests positive who is working someplace, why wouldn't we call out or name that business? Well, there's several reasons why we don't do that. Number one, it conveys a false assumption to the public that the business did something wrong. Now, I could go into any business in our district and look around, and I could probably point out some things that they could do better. But as long as people are making a sincere, honest effort to try to observe the rules that the governor has put into place, they're doing what they need to be doing. And to assume that the business is doing something wrong is a faulty assumption. It also, if we release the name of the business, it conveys a false sense of security that avoiding that business will keep you safe. It will not. You've got to understand that this is a community spread, widespread disease right now. As long as the business has properly sanitized and separated the employee who was positive. As long as they've taken the correct steps, it will do you no, there would be no benefit to avoiding that business. In fact, avoiding that business will create problems. Let's say that there was an employee of a grocery store, and now you think, or the public thinks, avoiding that grocery store is going to keep me safe. Well, that's going to push the public to other grocery stores, and the amount of traffic going through the stores that are left is going to be increased, and the disease is going to spread quicker because the crowds will be congregated across fewer locations. So instead of assuming that you can avoid a business and be safe, listen to our message about social distancing, staying 6 feet away from people. That is the message you need to hear, take to heart, and adopt. The other thing is if we call out a business, it disrupts essential services. The business that the governor has allowed to remain open, many of these are essential: food, gas, medical, pharmacy, food supply. If these services become disruptive, imagine how much harder it would be to live through this situation if you couldn't go to the grocery store because grocery stores were closed, or you couldn't get gasoline, or you couldn't get medical services or pharmacy. We don't want to disrupt essential services. Why is it that giving out the message about social distancing, why is that the best information that we can get out? Well, because this is an epidemic. It's actually a pandemic. This is a community spread disease that is worldwide. What do I mean by community spread? It means that people have it and it's spreading and we can't contain it. What do I mean? Well, we have to decide when we're utilizing our public health response, are we going to try to contain the situation, or are we going to mitigate the situation? We try to contain situations if we think containment is realistic. Where containment is not realistic, we try to mitigate. What do I mean by mitigate? We try to control how quickly it spreads and reduce the consequences of it. Therefore, the social messaging to social distance, to stay 6 feet apart, to cover your cough, to avoid crowds, stay home if you're sick. That's why we're saying those things, because no one in the world at this point has the expectation that we're going to be able to contain this disease. When you're out and about, you need to assume someone that you're running into has this, and you need to take the appropriate precautions. Let me give you an example of something we think we can contain versus something we think we can't, just so you maybe will understand this better. Seasonal flu is something we never have the expectation that we're going to contain. We always have a mitigation approach. We try to release information to the public about what can you do to prevent getting it in the first place. Something that we would have a containment strategy might be an STD. If someone has a sexually transmitted disease, that has to be reported to the health department. That's not a communicable, it's not a community spread disease. It's spread through sexual contact. Well, we can reach out to that individual, find out who they have relations with, reach out to them, find out who they have relations with, reach out to those, and eventually we can nail down everyone who could be spreading that STD, and we can contain it. But that's a very controlled situation. This situation with COVID-19, it's community spread. We're not going to be able to contain it. We can only mitigate it, try to slow it down so that too many people aren't getting sick at once and overwhelming the healthcare system. People ask me, if we can't contain it, why are we even bothering doing case and contact investigations? Well, case and contact investigations is part of mitigation. If we know someone has it, we want them to stay isolated. If we suspect someone has a high-risk exposure, we want them to be quarantined. Again, it's not with the hope that we're going to contain the disease in total, but if we can at least slow it down by doing those things, we want to do that. How does the COVID-19 process work? As far as the health department goes, well, a medical provider would, if they suspect someone might have it, they would take a lab specimen, send it to the lab. If it's, the lab will then report back to the provider whether the lab is positive or negative. The provider will then alert the health department and will alert the person who was tested. The local health department then immediately starts doing case and contact investigations. We don't do a public media release until after we have done our case and contact investigations. Why is that? Well, because if you've been exposed to COVID-19, if you're a high-risk person, who do you want to get your information from? Do you want to get it from social media, or do you want someone who is a medical provider who knows what they're talking about to be the one to call you, to give you the information, to give you medical advice and instructions about how you can keep your family safe? If we went immediately every time we knew of a positive case and immediately got on the air and said there's a positive case here, we would undermine our efforts to do our contact investigations and reach out to families and those who have been exposed, and to let them know what they need to do to be able to work through and deal with the situation. They deserve to have that information provided to them from a professional, not through social media. So we do our public information releases after that process, or at least when we're deep into that process. So far, our Lake Cumberland District Health Department has been very open to the media. We have done media releases many times. I've done, I can't tell you how many interviews, and in every single instance when we've had positive cases, that information's been released within hours, sometimes a little longer, like in this situation, but less than 24 hours. Sometimes we don't release information immediately in very complicated situations because we are still responding. And I'll talk about that a little bit more in just a second. As the incident commander of the COVID-19 Department Operations Center, it's primarily me who decides when we go public with information. If you have frustrations directed toward any other official in the district about that, your frustrations are misplaced. If you want to be frustrated at someone, be frustrated at me. It's me that decides that. We don't always go immediately public with complicated cases like the case in the nursing home. There's things that we must do before we go public. We must fully assess and understand the scope of the situation. The more complicated the situation is, the harder it is for us to assess and understand the scope. We must allow as much time as possible, and in this world of social media, despite our best efforts to be reaching out and notifying the people that needs to be notified, sometimes they're getting notified through social media instead of being notified by us. But as a matter of human decency, we try to reach out to the people that need to be contacted and give them the information before we release that to the public. I can say I was quite disappointed last night at the beating we were taking on social media for not having released this information last night. I saw a hashtag on one of the local papers, too many secrets or something like that. If you think I'm keeping secrets, you're wrong. If I'm not giving information immediately, it's because I don't want to cause harm. And I will give the information as quick as I can do it in a way that is positive for the community and not causing harm to the people who we're trying to contact to let them know what's going on, and until we get our hands around the situation. Generally speaking, we always provide a daily summary too that you can always check to be caught up on your situation. Why did we wait till this morning on Summit Manor? It's a complex situation. It takes time to fully assess what's going on. It takes time for us to notify, or for the facility. The facility was contacting families. It takes time to get all the individuals and families notified of the situation. We have to put together in these situations an immediate plan. What are we going to do right now? What are we going to do in 24 hours? What are we going to do after 24 hours? It takes us some time to get that stuff together, to get all the key people that needs to be having input into those decisions onto the same call. And again, I don't want to release information until we have all of those kinds of things together and in place. I can say yesterday we were notified about 2 or 3 o'clock Eastern time of this situation within minutes. We were assessing the staffing situation at the facility and how they were going to handle sheltering. We wanted to make sure that they were going to have enough staff to continue to be able to provide care. We wanted to make sure that if they felt like they needed to move patients out, that we had a plan in place to make that happen. That work had started within minutes of us being notified. I reached out to the state Health Operations Center, again within minutes to ascertain if we needed medical staff to be dispensed or dispatched to help staff this facility, would they be available? How quickly could we call them up? If we needed to move people out of this facility to another facility, where would that be? How would that happen? How quickly could we call that up? I was getting that information very quickly. I contacted the leadership at Summit Manor. We addressed these concerns. We started understanding that the staffing situation was going to be okay and that they were going to try to shelter their folks in the facility. We coordinated a conference call with the local folks there at Summit Manor, their key leadership and their corporate leadership, with our Department Operations Center and with the State Health Operations Center. On the State Health Operations Center call, there was the state epidemiologist, infection control physicians, the Office of Inspector General that oversees long-term care facilities, and staff that are embedded at the State Operations Center from the Centers for Disease Control. All these people were mobilized onto a call last night so we could work through the situation and start making decisions about how to best handle it. After we went through all of that and went through the different scenarios, we were confident in Summit Manor's plans. They had plans to move the patients in the building and to isolate them. They had plans to continue their staffing. They had plans to make sure that staff that was working the COVID unit wouldn't be working the rest of the building. They seemed to have their act together. We agreed that we would support their plans to follow through with their actions. And last night I asked the judge to just post something on her media page that we would do a news release this morning. By the time I got done with dealing with this last night, I wasn't mentally prepared to give a statement, and I didn't have all my thoughts organized. If you all feel like that wasn't acceptable, I don't know what else to say. I'm doing the best I can. I wanted to make sure that the families were notified before we said anything public. I wanted to make sure that the facility had an opportunity to start getting its plans in place, and I wanted to make sure I had my thoughts straight. So that's why we're doing it at 8:30 this morning instead of 9 or 10 o'clock last night. So, Judge, I'll turn it back over to you.
Thank you, Shawn. I'm going to turn it over to Mike, our EM director. He's got a statement he'd like to make.
Shawn, I appreciate the work that you all do. I know it's probably going to get worse within their communities, and I appreciate everything that you all are able to do. Ones that don't know me, I'm Mike Kellner, Adair County Emergency Management Director. Just listening to Shawn give this news, it's rough. I've been in emergency services for about 14 years, dealing with families in their worst times, from deputy coroner to EMS to fire. And I'll say, when I got the call yesterday, it was pretty rough taking that news. So something I wanted to talk about and mention, the numbers given today, and in our current world, in the situation we're in and that we're living in now, they can begin to feel impersonal. We must remember these numbers represent people and their involved families in our community. I've worked with so many of these people at Summit Manor for years, and I feel a deep connection to the many residents and their families. We talk to them all the time when I'm there listening, and it absolutely breaks my heart to have to hear the information and be a part of delivering the news to our community. We all do know it takes time to notify family and residents, and for that family to notify the friends and family members that they choose. This creates a delay in informing non-impacted public that we must abide by. I know for my personal, I received a call from my mother informing me about my grandmother. So she's at the facility, and I think we're still waiting for some information to come back on her. So it makes it rough. We've got to remember these people, keep these families, friends, and people in our hearts as it progresses. We'll say emergency management, along with all our other community partners, which is a big group, take this pandemic seriously. We have been working to keep our community informed in preventative measures as quality verified information is provided to us. The importance of social distancing is evident in today's report in the facility where people have unavoidable close interactions. Please abide by all measures as recommended and as we are able to put out. Doesn't have to be said, but from all of us in Adair County Emergency Management, we offer continued support to Summit Manor and everyone during this difficult time. Thank you, Judge. Thank you, Shawn.
Mayor, do you have a comment you want to make? Or?
I want to reiterate just what Mike said. I have a closeness with the nursing home also, have for years, and my concern is with the residents there, the staff there, and this affects all of our community, so our prayers are with them.
If the media has questions, I'll try to answer what I can.
Yes, sir. I did have a question about, and I asked you this briefly yesterday, but I know you're still, trying to figure out what was going on. Do you know whether the facility center was following the proper protocol before before the first case, and whether they continued to do that after they had the first case? What was their response?
I can tell you that, as I said earlier, I could walk into any business in our district and find things I think they could do better. But do I think Summit Manor was taking precautions? Yes, I do. In hindsight, I'm sure we could go back and dig through every detail and maybe see something that could have been done differently. But they were putting a concerted effort forward to try to observe the recommendations that had been given to them by the people who are in authority. Here's the situation with COVID-19. You can have this disease. You can have asymptomatic symptoms, meaning you don't feel symptomatic, or you can have very mild symptoms. You don't even know you have it, but you're still spreading it. I mean, I speculate that, and this is totally speculation, as I don't know how it got into the building, but I speculate maybe an employee had it, they didn't know they had it, or maybe one of the essential people that's allowed to come into the building had it. Didn't know they had it, didn't know they were causing anyone any kind of issue, didn't know they were doing anything wrong. They weren't doing anything wrong. They didn't know they have it. They were required to be there. It was essential that they be there. But they come in, and since they have it, they're still spreading it. They don't know they have it, but they spread it. And it gets into the facility, and you get what we get. This is going to happen in many more locations: jails, personal care homes, long-term care facilities, other residential facilities. It's going to enter those facilities in the same way. And it won't be that they're doing anything wrong. So, my best advice is, guys, we all need to observe the social distancing. We need to, if the folks at Summit Manor, they're wearing the personal protective equipment, they're doing the things that they need to do. For anyone that's listening in who runs any kind of residential facility, I would say, be vigilant following your plans, but be ready. If a case comes in there, are you ready to separate people quickly? Are you ready to put up a designated part of your facility as a COVID part where you can isolate it and separate it? You need to not only have a prevention plan, but you need to have what are we going to do if we get it planned, because some more are going to get it.
And I'm not suggesting, Shawn, that they did anything wrong. That's just been a question in the community about were they following the protocol.
They were, just like, I mean, this has popped up in other places where people were following the rules too. And it's just the nature of this disease. You spread it before you even know you have it. And certainly if you're sick, don't come to work. If you feel symptomatic, stay home. We don't have any reason to believe anyone felt sick and worked there. I'm not trying to imply that. I'm just saying, as a general rule, if you're still working and you feel sick, stay home, because it's bad enough that you might be spreading it not knowing you're sick. Certainly don't do it if you know you might have it.
Well, to your point, though, the visitation had been locked. There had been no visitation, so no family in for some time.
That's correct.
And then you wait for it to get in other than an employee or essential personnel, right? I mean, it didn't originate inside the facility.
That's the same logic I'm using. And again, that would not be, if you're asymptomatic or have very mild symptoms, you just didn't know you were bringing it in. So it's not a time to point fingers and to throw rocks at Summit Manor. It's a time of love and compassion and empathy, and let's pull together and see if we can get ourselves through this with as least amount of harm as possible. Turning on each other is not going to make it better.
Well, on that note, I mean, because there may be other long-term care facilities that are looking at this right now, what do they need to be doing right now? I mean, do they need to be all wearing masks, all with PPE, gowns, all that stuff right now?
They've been given directions. This is the staff wearing N95 masks is not a necessary thing. It's not a airborne disease. The best we can tell from all the information that we have, it doesn't linger for a long time in the air to the point where you would need N95 masks. It's a droplet spread disease, coughs and sneeze, larger droplets. So surgical masks are fine. Even homemade masks, if they're made properly, can be fine. So yes, those staff are using, well, if any facility that's not, they should, but we have reached out to all of them and they've been given instructions and from us and from other sources about, how to protect the population. So yeah, they should at least be wearing the some sort of surgical mask or a homemade mask that would meet surgical mask standards. And you can find that information on the Centers for Disease Control website, how to make those masks.
Can you tell us how many folks are in? You've had 23 positive out of how
I think
many?
I think their census is maybe 71 is what's popping into my mind. If that's not completely accurate, it's really close of their patient. And I think roughly they have about one staff per patient. I don't, that when we were talking about it the other day, I did a calculation in my mind and said that's about a 1-to-1. And so it's not exactly that, but, and if I'm wrong, I'm just wrong, but that's what stuck in my mind.
So bottom line, 24 out of 140 roughly that's known at this point?
Well, there was 6 we knew about already, so that's 30. One of those passed away.
I'm sorry, maybe I'm misunderstanding. What's the total number out of the facilities you know right now? 30?
At the facility, I think 29. Well, no, because some of those are in the hospital. So there are at least the 23 that were positive from this last lab result are there, except the one that was moved out last night. That's probably 22. There was 6 positive cases identified last week, and some of those were moved out. I don't know if they've been moved back in yet or not. So,
well, you had said earlier, I think 6 and 3 employees. Is that so? You got one.
That's what we knew as of last week. Now we know of 23 more residents and 1 more staff.
So is the correct number 29 residents and 4 staff?
Let's see, 20. That sounds about right, yes.
Okay.
But now there will be some additional test results coming in. I think most of the patients' test results are back. Some of the staff test results are still outstanding, and they will come in over the next couple of days. There could be more.
And at this point, you only know of the one lady who died? Is that right?
1 person from the facility passed away last week, 1 resident.
Nothing additional on that?
I'm sorry?
Nothing additional on that? No other deaths?
No, sir.
Associated with this? Okay. That's all.
First, Judge, I know last time you asked or invited someone from Signature to come here. Did you invite someone to come again today and they sent them instead? Or?
Yeah.
I've got some, may have better information. I talked with Signature this morning. I encouraged them not to send someone. They've had a lot of exposure. I didn't necessarily want someone coming in just because of the issues with they could have been exposed. But 2, they need to be there working right now. So, I've read their press release. I felt it was sufficient, and I felt like the better use of their resources was to keep their people on site doing what they needed to be doing to prepare the facility and to take care of the patients. They agreed with that. They were willing to send somebody. I asked them not to. I asked them to just provide the statement. So that was the logic behind that.
Well, I just want to say, I've been trying to get the number of how many of our positives up until this time were either Summit Manor employees or residents. And, I've not been getting good information. I'm trying not to harass you and use the system you've set up for me to gather information. But Bill and I have been friends for years. Lexington Herald's here today, and he knew more yesterday afternoon than I did. And
that may have been because
I've been in communications with my county judge, and I know she's struggling to get hold of information. And when my concern is when people from weather.com or the daily newspapers can get more access to information than I can, then we're part of this team. My phone has been blowing up too, and I've had family members of loved ones and of people in residents. I've had family members of employees there questioning about the mask, why someone is working around positive people with just surgical masks. And if I can't answer those questions, then I'm failing. And if I can't get that information from you, then I'm not part of the team anymore, and
Yeah.
I'm going somewhere else.
Well, let me say, I'm sorry for your experience. I'm not always available to give that information immediately, even if I have it, because, you know, we're getting new cases coming in every day, and I have to decide where I'm going to spend my time. Am I going to spend my time working on how are we responding to this new situation, or am I going to spend my time on the phone updating the public? There's times when it's more important that I'm spending my time mobilizing the response than I am talking on the phone. So if you're not getting the information as quickly as you would like, I apologize. I mean, there's only so much of us to go around, and we're doing the best we can. As far as weather app, whatever that is, that app is causing more problems than it's helping. Here's what it's doing. Most of the time their information is wrong. So therefore, I'm having to answer phone calls from the public about why didn't the information line up. That's time I could be using doing something else that is really important. If you want accurate information, use our website. We update it every night of our case situation, with the exception of last night. We didn't update it because we wanted to wait until after this news release. That'll be balanced out today. Our information for Lake Cumberland is more accurate than the governor's information, because he gets the information and they have to validate it, and it's probably a day or two or even 3 behind their information. When we post something on our website, it is lab confirmed cases that we are absolutely certain are there. Now, the only thing we might get wrong is we might believe someone is local, and we find out later they actually lived in, you know, on the border of another county, or they worked here but they actually were commuting in. Sometimes the number might change a little bit because of some circumstance like that. But the best information is always going to be available on our website. We do a daily brief, and we update our statistics on our website. Since this experience started, this is the first time I held that information until the next day. So, and that was only because we understood this was a very sensitive situation. We wanted the facility to be able to contact the family members before we went public. We wanted to get our information together. We just thought it would create more chaos to release it last night when everybody was in the middle of the event, trying to get the patients moved in the facility, trying to contact people, trying to mobilize our response. It would have created more chaos for us trying to answer all the questions than it would be for us to just concentrate on the response. So I hope that's good enough. And I again, this was emotional for all of us, and I know we're all on the same team and trying to do the best we can. I hope we're all living up to your expectations as best we can.
Do you have the number of negatives they've gotten back yet? I
probably do. I just didn't write that down, so I can't say that. Whatever I say would be speculation, and I don't want to do that.
And have they had a specialized infectious cleaning team come in to clean the part where the non-infected residents will still be staying, or anything like that? Do you know?
They have an outside, Corey may know this, they have an outside vendor that comes in that does their cleaning. That's a professional outfit that does this. And we have provided for them, if they didn't have it already, the extra guidance you need for COVID-19. And I have every reason to believe they're honoring that. Corey, do you have anything different?
That's accurate.
That's accurate. Corey's my environmental employee here in the county, and he's also our planning liaison locally to work with the local folks. So I'm asking him, he's socially distanced at the very back of the room.
I've had a couple comments from a couple places of some staff members who have not been tested. Is there any monitoring to make sure that everyone is in fact being tested?
What places are you talking about?
Excuse me?
You said of places where staff had.
No, at the nursing home, they said they tested all residents and all staff.
That's the information I have.
Okay, is anyone monitoring, I mean, is that part of what you guys do, is to monitor? Are you checking to make sure that they're doing those things? Is there some monitoring that goes on to make sure they're following this protocol?
I don't second check behind them. When they tell me they've tested everyone, I believe that they have. So, I mean, I have no reason to doubt what they're telling me is not accurate. So I haven't second double checked, or whatever the right word is. I haven't gone behind them to make sure, to validate that. But I have no reason to believe that they would be deceiving me.
Do you know if they have adequate supplies? Are they in need of any?
We discussed that this morning. I discussed it with their facility manager on the way over here. I discussed with emergency management what resources are local. They're okay right now for the immediate with PPE, personal protective equipment, and the supplies that they need. We did discuss their burn rates and how to preserve that, and they're on that. It's PPE's in short supply. We talked about alternatives that they could use, if we have to get to the point of using homemade masks and stuff, let's anticipate that sooner instead of later and make sure those resources are available. There's a considerable amount of supplies that emergency management has on hand. You might want to address that.
Yeah, would it hurt to mention specific numbers as what they received?
That's up to you.
Okay.
Yeah.
I'll discuss on the 20th of March, we received S&S supplies. We distribute those as we were recommended to the direction that we were given. Summit Manor received over 3,000 masks, different types. I want to say probably close to 3,500 in the amount. I don't have the specifics. That was the majority of our shipment was received was the masks, and we see that's what we need now. So they have a large number. We're monitoring the burn rate with them, and we've been working really closely. Our biggest concern when we got this was the possibility of having a need or something at the nursing home, and we knew that would be a very critical facility for us, as it would if it was a hospital or something of the sort. But with the population there at the nursing home, we knew that would be one of our main concerns. So we tried to dedicate enough reserve just in case that we could come to those facilities in need, whoever it be, and we have a bit built for supplementing anything that they can need as far as the mask and things go. But we do know gowns and things are in very short order. We're unable to procure any at the time, but I think that's nationwide, as even as the governor says, they try to get an order and they get canceled before they arrive. So as of, I believe yesterday, we had a good count that they were okay at Summit Manor, but we'll continue to do whatever we can for them until we basically run out. So.
Okay, if no one else has any questions, I'm going to just say that I do agree with Shawn on waiting till this morning on giving this update. Out of respect for the families, Summit Manor wanted the opportunity to be able to notify family members, and I agree with that. I've got my phone has blew up all night. The community needs to know. If you're not directly associated with them, I'm going to disagree. You don't need to know, you want to know. But I think we handled this correctly, and we will get information out to our community. I promised that I would do that, and I intend to continue to do that. But I think we had critical steps here that needed to be followed, and I'm glad that's the way we went. So if no one else has anything, I think we can just ask everybody, just continue to remember these people in your prayers. They need it. The staff needs it. The residents need it. Family members need it. And our community needs it. So, and that's all I have. So, thank you all.
Thank
and
you all for having me. Thanks for coming.
Thanks, Shawn. And, if we get more information, we'll follow up.